Where else would you rather be? I'm Paul Clifford, CEO of the Penn State Alumni Association. Welcome to the People of Penn State. Each week on the podcast, you can expect to hear the voices of Penn Staters talking about what they're passionate about, and you can expect to feel the pride and the power of the Penn State network. Today on the podcast, we talk with Dr. Katie McPeak. She is a primary care pediatrician and medical director for health equity at Children's Hospital of Philadelphia Primary Care Network. She is also an associate professor of clinical pediatrics at the Perelman School of Medicine at the University of Pennsylvania. Dr. McPeak has extensive experience in quality improvement systems redesign and primary care management in predominantly Medicaid-insured and underserved communities. Dr. McPeak is certified Spanish-speaking provider. Her goals are to reduce disparities in care for children and to put the family and patient at the center of care redesign. She has strong interest in improving care of limited English proficient patients, children with special healthcare needs, and strengthening care teams. Please welcome to the podcast, Dr. Katie McPeak. Katie, how are you doing?
Hey, Paul. Thanks for having me today.
Oh, it's wonderful to have you here on the podcast. Let's get started right at the very beginning. How did you become a Penn State NY Lion?
Oh, I love thinking about this because it was so long ago. I am the oldest of 4 kids, and my parents divorced when I was really young. So I didn't really have a ton of exposure. I didn't visit a lot of schools when I was in high school. I didn't have older siblings. And when I was in 11th grade, my friend from high school, Pam, her older sister was a Penn State student, and we went up to visit her. And I was completely blown away. I don't think I had ever been to a college campus before then. And I remember going to a step aerobics class in the White Building and walking around campus. I was just blown away. So when I was a senior and applying to schools, of course, I had all these grand ambitions. I already knew I wanted to go to medical school. I was one of the first in my family to go to college. But I veered outside of Penn State for a while. I looked at Boston College, UNC, University of Pittsburgh. And ultimately, Penn State just ended up being the right choice for me. Financially, I knew I had at least 8 years of schooling ahead of me. I didn't have any means to pay for college. I knew I was going to accrue a lot of debt. So for me, it was about value, experience, the beauty of the campus, and just knowing I already had some people that I knew there. So I felt really comfortable.
All right. So step aerobics at the White Building sold you on Penn State. You come to Penn State. What were you involved with as a student?
Well, I started at Penn State when dinosaurs roamed the earth in 1993. And from the beginning, my first year, I was just really focused on trying to survive. But during my second year, I joined a sorority. I joined Alpha Chi Omega. And I would say that most of my involvement stemmed from there. I became the education chair for the sorority, really supporting other students with their educational needs. I got very involved with Thon, which I think was a big driver for me in choosing pediatric healthcare. My experiences with Thon really drove me to want to become a pediatric oncologist. That changed later on in my career, but those experiences were pivotal.
And when you came to Penn State, I mean, you said you knew you wanted to go into healthcare, but did you know what you wanted to specialize in? Were you laser focused and kind of on the same path the entire way, or did you come kind of open to a lot of possibilities and the influence of Thon moved you into pediatric healthcare?
I think that's a really interesting question, Paul, and one that I don't think I've ever been asked before, which is cool. So good job. I would say that being the oldest of 4 kids, having, really great family and inspiration, and I worked with children, my whole childhood. I was always supervising somebody or bossing someone around. It was a pretty natural path for me. medical school was always the goal. Even when I matriculated at Penn State, I was a pre-med major. So going into pediatrics just felt like a really linear path for me. You do have time to decide what you're going to do within medical school. You don't have to decide your specialty until really the middle to end of your third year. And I did toy around with becoming a surgeon for a while. I was one of those students that loved every single rotation in medical school. So I could see myself in every single shoe. But ultimately, I always ended up back right where I started.
This is the People of Penn State. I'm Paul Clifford. I'm joined today by Dr. Katie McPeak. She's the medical director for health equity at the Children's Hospital of Philadelphia Primary Care Network. So I want to dive into that title, because that's just one of the titles that you hold. You're also an associate professor of clinical pediatrics. I was just on your LinkedIn page, and both of those jobs are listed as full-time jobs. So it sounds like you have two full-time jobs. How do you balance your role as the medical director and all of those responsibilities, and then at the same time be an associate professor for clinical pediatrics at the University of Pennsylvania?
Well, that's a great question, Paul. And I actually don't have two jobs. I have like 20. So much like many of us, I do some health services research. I teach courses at the School of Medicine. I teach a class on healthcare disparities and healthcare systems to Penn medical students. I'm also an advisory dean at the School of Medicine. So I oversee the path for about 35 medical students at Penn. From their first year of medical school, I actually am just meeting with the new matriculants right now this week, who are just brand new medical students right out of college, or most students actually take a gap year. And I follow them all the way through until they receive their medical degree from Penn and graduate. I also do a lot of teaching in the residency program. So after you finish medical school, you go on to do a training specific to your specialty of interest. And since I work in pediatrics, I oversee and support residents that are specifically invested and interested in health equity and health disparities, health policy. That's called our LEAP track. So I don't have two jobs. I have about 10, but all of that amalgamates into one full-time equivalent. It's probably more like 1.5. How do I balance it? I exercise every day. I have two kids. They're 12 and 14. I'm always behind an email, and I'm really proud to admit that, because I really don't work in the evenings or after hours unless I'm seeing patients. I do work evenings and weekends clinically, so I try to really cut off at 6 p.m. when I can, so that I can be with my family.
It sounds like a lot of time management, a lot of prioritization and reprioritizing, right, to make sure that your family gets the time that they need with you. I would, if we had more time, I would challenge the 1.5, because it sounds like it's probably closer to 2 or 3.5. There's probably a cape under those scrubs with the superhero powers that you have. You are interested in a number of different aspects of healthcare. In your intro, I talked about the affinity and the interest that you have in the care of children and pediatrics. I talked about how you're a certified in Spanish care and health disparities, right? So I want to talk and dig in a little bit into each of those. First, what are some of the greatest challenges that are facing children today, especially in under-resourced communities?
That is a really important question, and one that I hope all of our listeners really lean into. In the summer of 2020, when George Floyd was murdered, our country experienced, I think, a real necessary awakening about the impact of structural racism and structural inequality in our children and families and just people. We know that our country has a really challenged history. We have a lot to be proud of, but a lot of really a dark past. And for 400 years, we've just set up some really difficult circumstances for people, especially those who identify as Black, Latinx, immigrants, those with disabilities, LGBTQ+. So you can find disparities no matter how you slice or dice it, but we really see in kids that those are the fundamental drivers of health inequity. I just finished up a meeting from 8 to 9 on management of children with elevated lead levels. And if you're Black and live in Philadelphia and insured by Medicaid, you are far more likely to have lead poisoning. We know that from Flint, Michigan. If you are a Philadelphia resident and you live in the zip code where I practice medicine, 19139, your life expectancy is 20 years shorter than for people that live in my zip code, 19072. So your zip code determines way more about your healthcare than your genetic code. One example that I always like to think about is just school funding. Recently, there has been a challenge to Pennsylvania's school funding by Children's First, which is a really terrific advocacy organization. The school district where my children attend, Lower Merion, receives significantly more funding per student because of higher property taxes than the kids who go to school in Philadelphia. My team has also published research that during the COVID pandemic, children who identified as Black or Latinx actually experienced much higher rates and faster acceleration of obesity than their white counterparts. And that is not because of family choices or because of individual risk factors. It's because we have set it up this way. The schools were shut down longer. Kids have lower access to sports and fun things to do. Sports are really expensive. Housing is really challenged. Neighborhoods are not safe. Kids can't go out to play. And that really impacted how children experienced COVID-19. So that's just a start, but really these fundamental differences in healthcare outcomes go down to the root, which is the structural inequality in our society. It's things that we're really working on to improve.
Katie, how does trust play into all of this? Because we know that there's inequities, right? But even when there is access to healthcare, there's still trust of the healthcare system from underserved communities. Can you talk a little bit about how that impacts how they often and how underserved communities seek out healthcare?
Yeah, that's a really, really great question, Paul. So unfortunately, the healthcare system and especially physicians do not look like the patients that we serve. So the practice where I'm situated in West Philly, it's a really great practice. We're called the Carabots Primary Care Center. I'm actually seeing patients all day today, and I am white. I grew up middle class, and I grew up in Bucks County, PA. I am not from the community that I serve. I don't look like my patients. I don't have the same lived experiences as them. So when you are from the community that you serve, when you look like the patients that you serve, when you speak the language that your patients and families serve, there's just a higher degree of trust. And there's actually research that demonstrates that health outcomes are better when you have parity in that relationship. So how does trust affect relationships with patients? One is that we all inherently experience and have our own biases, and we all inherently have some forms of discrimination. So I think it's really critical if you are going to serve in a community that you don't look like or that you don't share the same lived experiences from, you have to practice with extreme humility. I consider the only expert in the room to be the patient and family and the parent. I am not the expert. So things that I try to do are shared decision making. What do you think about this? I don't lecture to my patients. I try really hard to spend a lot more time listening than talking. I try not to ever stand when I'm in the room. I sit. When I'm speaking Spanish with families, I always ask them if my Spanish is sufficient and do they need an interpreter. So really for me, it's about humility. Tell me about your family. What goals do you have for your child? How can I help support you today? Rather than saying, you're not following this, you no-showed to this appointment. Rather asking the family about what barriers got in the way, how can I support you? tell me more about the challenges that your family is facing. And that's worked really well for me. I've been at this for over 20 years now.
Talk about your interest in Spanish and how that helps you connect at a different level with your patients than somebody who might be using an interpreter, or someone who might have to have another family member in the room interpret for them. I would imagine that it allows you to connect more directly and at a deeper level with your patients.
100%. I'm so glad you brought that up. And because we're on a Penn State podcast, I must say that my love and interest in Spanish language actually started at Penn State. So I was meeting with my pre-med advisor. I think her name might have been Amy. And I took French when I was in high school, and I was pretty good at it. She said to me during my sophomore year, boy, if you're really thinking about going to medical school, you should consider pivoting to Spanish. This was 1994. The landscape of the US was totally different. Right now, by 2050, almost 50% of Americans will speak Spanish in their household. That was not the case in the 90s. We've seen a huge wave of immigration, which has made our country so rich and so interesting and so diverse. But this advisor really helped me understand that this would be a really important skill. I only took 3 semesters. I remember my teacher was from Puerto Rico. He was really engaged. He was so passionate. And I fell in love with the language. I don't really speak French anymore, but I speak Spanish every single day of my career. In terms of your second point about being able to connect more with patients, I am still not from the community that they are from. So many of my patients are from Ecuador, Guatemala, they're from Puerto Rico, they're from La República Dominicana, they're from all these places, all these really interesting places. So what I might say to them is, hey guys, soy la doctora, I'm not from Central America or South America, pero hablo español. Tell me a little bit about you, tell me about your culture, tell me about your family. And that's also worked really well for me. And then I just ask them if there's anything you want to share with me or any concerns you have, I'm always here for you. I never, ever recommend using family members as interpreters. So for those of the students who are on listening that are pre-med, we always recommend using a certified Spanish speaking or certified in the language that you serve. I have a Spanish badge. I've passed proficiency testing. So we recommend that if you are taking Spanish at Penn State and you plan to go to medical school, you really need to become certified as a qualified bilingual provider and spend a lot of time in the community. I spent a lot of time in Ecuador and Guatemala, where I really refined those skills.
Yeah, I would imagine that there is a lot that's lost in translation because of caring and love when you use a family member to interpret, right? The one family member who is sick may understate the severity of what they're feeling because they don't want their family member to worry. The family member as a translator may not be translating exactly what they're hearing because of how they're interpreting what they're hearing from a loved one, and so there's a filter of that love and care for somebody else that might have an impact on honesty and truth.
You nailed it right on the head. And some of the things I ask families about are really sensitive: social determinants of health, intimate partner violence. So if I'm asking a child to translate for their parent and saying, sweetie, is your dad hurting your mom? Can you imagine asking that to a child? So you're exactly right, Paul. Those are the reasons why I encourage any student who is even thinking about medical school. It doesn't have to be Spanish, but becoming proficient in another language and then committing your life to serving that population is really, really special. It's been one of the greatest satisfiers of my career, for sure.
So, Katie, in some of my research leading up to the podcast, I also know that you've been pretty outspoken about the use of opioids in pediatric healthcare. Can you talk a little bit about that and the negative impacts that opioids would have on children?
So opioids are so addictive. One dose of OxyContin or one snort, you can become profoundly addicted. And we've just seen, hundreds of thousands of lives destroyed. So it's a great question, Paul. I work in an area, or at least I had for the past 10 years when I worked in North Philadelphia, that has been completely decimated by the opioid crisis. So I counsel families a lot on removing opioids from their home, using safe drop boxes at police stations to return any unused medications. I just had surgery on June 20th, and I returned my opioid medications, only used one dose after severe knee pain, because that addiction is real. Now, we want people to be able to use opioids for severe pain, for kids with cancer, for people who are experiencing severe life-threatening illnesses. They're really great medications for those that are used appropriately. But for those of us in primary care, we should really rarely, almost never be prescribing these medications. Our role is really to counsel on safe disposal, counseling our teens on really avoiding any trial of these medications or drugs. They're extremely addicting.
You talked earlier about kind of health and structural inequity in healthcare. And I think when I hear something like that, the way I think about changing it is through the advocacy groups that you've talked about, maybe working with legislators or local governments to help address those. But we're talking to fellow Penn Staters, right? So what are some things that our listeners can do to address the inequities in healthcare? Is there something that all of us can be doing to address these inequities?
Great question. I'm going to put in a plug for a program that just started at Penn State 2 years ago. And this is called the Summer Rise Up program. And Paul, you might know about this from the Alumni Association, but Rise Up stands for Representation in Science and Engineering. And this program, I am so passionate about it. Go to their website and donate. We need to build the pipeline for healthcare professionals that look like the communities that we serve. In a community like mine, where I'm working right now in West Philly, that's 75 to 80% Black or African American, 75% of our doctors in my office should look like the patients that I serve, but it's not true because there is a fracture in our pipeline. And we know that starts from pre-K, from discrimination, from poor school funding. So a couple things: donate to Rise Up, go to the website, check out the program. We provide housing and structured curriculum for 6 weeks. We fund the students to come to CHOP and Penn and spend a day with us. We just did this on July 20th. We taught the students how to suture like they were surgeons. We took them to a driving simulator and taught them about our safety research. And these students are all now freshmen at Penn State, and they come from more underrepresented backgrounds in medicine. And it is an incredible program. Another place where folks can look is places like the Commonwealth Fund. The Commonwealth Fund has a great podcast that talks about health disparities and health inequities. I also strongly recommend for people in the Philadelphia region looking at Children First, which is a tremendous advocacy organization. And they have some wonderful materials about lead poisoning, housing, structural discrimination, structural racism. And then if you're just looking for data or for students that want to display some data in their research, I really like the Annie E. Casey Foundation, which has some really wonderful maps and heat maps that help look at where the disparities are by certain populations and zip codes.
I love those suggestions. We will drop each of those in the show notes on the podcast. We also have it if you're watching on YouTube. It is scrolling across the bottom of the screen where you can see the web address for Rise Up. And so, I think it's easy to sit back and say, I wish our government, or I wish, the General Assembly or our legislature would really address this. But there are things that we can all be doing to address these health inequities. And I'm fascinated by the connection you continue to make between the funding, educational funding, with access to to healthcare. Can you talk a little bit more about the connections between the school districts, the zip codes, and how that impacts the level of healthcare that those communities receive? I would think that those would be two systems that aren't connected. And maybe they're not connected and it's just a correlation. But you've gone back to it a couple different times. I'd love to hear more about it.
Well, Paul, as a pediatrician, your outcomes start before you're even born, right? So we talked a lot about the zip code determining more than your genetic code. When you start school, you start your pathway to education. So I went to Council Rock High School in a very well-funded school district. Even though my parents were pretty gritty, my dad went to Vietnam and served as a Marine in 1968 in the war. My mom never went to college. She started out in the restaurant industry as a waitress and bartender and worked her way up to event management. But they knew that education was really important. My family moved out of North Philadelphia in the late 60s and relocated in Bucks County. So my path was already predetermined. First of all, the color of my skin confers more advantages for me because of bias. Secondly, I grew up in a wealthy school district. I was given a lot of resources. I took biology as an 8th grader. I had a path and I had mentors. For students that are in overcrowded, underfunded schools, they're already behind before they even get to Penn State, before they even get to college. We know that high school graduation rates are lower. And when you talk about that and you stratify who has healthier outcomes, people with higher advanced degrees, who live in wealthier communities, who have less manual labor for their work, are going to have healthier outcomes because they have different access to healthcare and they have less stress and burden in their life. So it really starts all with education.
Excellent. Thanks, Katie. This is the People of Penn State. I'm Paul Clifford. I'm joined today by Dr. Katie McPeak. She's the medical director, health equity at the Children's Hospital of Pennsylvania's primary care network. Katie, at the end of our podcasts, we like to have a little bit of fun with our guests. And so I'm going to throw you some quick hitter questions to get to know you better. And you just say the first thing that comes to mind.
I'm ready. Batter up.
All right. Your favorite class at Penn State?
Okay. I have several. One is the biology of aging, which was a 400 level biology class that I took, I think my senior year. And I just thought it was so interesting and also really ironic because I'm a pediatrician. I loved Theater 100. I think I also fondly remember that because I received the call that I was accepted to medical school while I was in taking Theater 100.
All right. This one's a classic Penn State debate. Sheets or Wawa?
Oh, Wawa, 100%. Like not even a consideration.
All right. How about a classic Philly debate? Pats or Geno's?
Neither. D'Alessandro's. It's a no-brainer. Again, stop asking these ridiculous questions.
Everyone I've ever interviewed from Philadelphia, that has been the answer.
Whoa. That's because people don't know what they're doing.
The answer's been neither, and then they insert their favorite place. So it's not always D'Alessandro's, but
yeah. D'Alessandro's is the gold standard.
If you can have dinner with anyone, who would it be and why?
Well, I would love to have dinner with my grandmother, who has been gone for about 5 years now, just so that I could be with her again. But in terms of famous people, I would say Barack Obama, just so that I could be in the same, and Michelle. Let's have them, and maybe Sasha and Malia too. I'd like to sit with the whole family.
Where would you take them in Philadelphia?
Oh man, that's a really hard question. I think I would take them to Soraya, which is a really beautiful Lebanese Middle Eastern restaurant in Fishtown. Or I might enjoy just going to Pizzeria Badia, which is a kind of cool, really fun pizza place.
You're going to have to send me the information for Soraya. My family's Lebanese, and we're always looking for good Lebanese restaurants.
It's delicious.
We were just in London, and were blown away by the restaurants that we found over there. It's phenomenal.
It's beautiful. And if Barack and Michelle are listening, I am available. I'll even cancel my clinical shift, or I'll get someone to cover me so that we can have dinner together.
That's awesome. Well, I know that they, from time to time, do listen to the podcast, so hopefully that will, hopefully they'll reach out to you.
I hope so.
What's your most unusual "we are" moment? Either a place where you saw a Penn Stater and yelled out "we are," or they recognized you as a Penn Stater and shouted out "we are"?
Oh gosh. I mean, this happens to me literally all the time. I was actually at the gym the other day, and I live in Montgomery County. So Pennsylvania, 1 in 6 people that graduated college went to Penn State in Pennsylvania, or some statistic like that. But I saw a kid wearing a "We Are, class of 2023" shirt. And I just went up, I'm like an old lady, and I went up to him. I'm like, "Hey, are you just starting at Penn State?" And he was so excited to talk to me. But I've also, I've lived in San Francisco, Denver. I was part of the local chapter of the Penn State Alumni Association in the Bay Area. So I would just love seeing people 3,000 miles from home. I have seen Penn Staters when I've been in London and have in the airport yelled out "We Are" at Heathrow. I'd say it happens all the time.
How about your favorite Penn State sport?
Okay, this is tough. I'm going to say soccer because my son aspires to play for Penn State. He's 12. So coach, if you're listening, my son is Desmond Convery. He plays for MLS Next in Delaware, even though I don't live in Delaware. And his dream is to play Penn State soccer, but a close second is definitely football and basketball.
Excellent. And how about your favorite flavor of creamery ice cream?
Okay, also impossible to answer. But when I was on campus 2 years ago for an award ceremony, they convinced me to try some Charlie's Sundae or something.
Oh, Crazy Charlie Sundae.
Yes, that is amazing. But I'm also a classic Peachy Paterno gal, and I love mint chocolate chip.
Oh, that's wonderful. Crazy Charlie is one of the few named flavors named for a former vice president of development and alumni relations here at Penn State. It is one of the favorites, but it's a seasonal. It is a seasonal flavor, so you can't get it year round. So
why?
You lucked out when you were there. The creamery produces something like, I want to say 100 different combinations or flavors, and so they only ever have 30 or so available at any one time. Okay,
that's insane. So creamery, if you're listening, I want Crazy Charlie's Sundae all the time. And also grilled sticky is really good.
Grilled sticky is one of the more consistent ones.
Yeah.
Absolutely. Katie, I want to thank you for joining us on the People of Penn State. It's alumni like you who allow us to share your story with fellow Penn Staters that helps to elevate the value of all of our degrees. And for that, we're truly grateful.
This has been so much fun, and I just am so grateful for spending this time with you. And go State.
Absolutely. Thank you to our producer, Vincent Longaro. If you like this episode, I hope that you'll subscribe to the People of Penn State in your favorite podcast app of choice. And while you're out there, give us a rating, drop us a review, help us to spread the word to other Penn Staters about the great stories that you hear on the People of Penn State. If you're a member of the Alumni Association, thank you for your support. If you're not yet a member, what are you waiting for? Go to our website at alumni.psu.edu, and you too can become a member of the world's largest alumni association. Thank you for tuning in and for all you do for the university, for the glory, and for the future. We are